So we'll kick off again with two discussions. The first is the state manager or guarantor. So Didier Bazocchi, Jean-Pierre Dor, Frédéric von Rockenghem et Olivier Véran. So the debates will be moderated by Jean-Claude Prager. Well, hello. So the subject is the state manager or guarantor. It's not, raise the target. This is what Jean-Louis Strauss said. You've got to set them as high as possible. So this is a very broad subject that really concerns public life and French society. The social promise of 45 is concerned, and the French preference for administrative systems, and I say that pejoratively. It also concerns our relative fear in relation to change. This is what we talked about in the previous debate. We're not talking about law or what we're entitled to. It's a question of fine-tuning a difficult cursor. Problems rain down, we grow civil servants, and, we're still seeing problems raining down on us, of increasing demand for guarantees, increasing demand for financing. We're planting guarantees and medical progress. In France, it's the MMA, GMF, MAF. So the MAF that everybody prefers, the MAF being health insurance. The first sequence, let's have a look at the situation. So I'm going to hand over to Olivier Véran, who's going to start, and then we'll go around the table. Yes, thank you very much. So the question interest is to set clear objectives, set the guidelines, and allow access to health. We all know here that it's much more complicated than it looks. The freedoms of different actors. Now, then there is the question of financing. We've been talking about financing for the last 2 days. We've got a system that is at the costs are increasing. There is medical progress. The population is getting older, and there are lots of chronic diseases. Now, we have to keep